Okay, so you may have been asked to accept the recording, or you may not have been asked, but anyway. So, as I said, we got a lot of questions about tinnitus. It comes up fairly regularly in our general Q&As, and we tend to address it for just a minute or two. So we decided really that maybe we should do a longer webinar on that particular topic. And that's one of the things we're doing, is longer Q&As on very specific topics. So a few weeks back, we did one on the menopause, and we'll be doing one on sinusitis coming up next month as well. But for this evening, we're going to talk about tinnitus, or tinnitus, or tinnitus, whichever way you want to pronounce it. And we're looking at this from an Ayurvedic perspective. Now, I know a lot of you on the call, I recognize your names. I know you're familiar with Ayurveda, but as I say, I see some people that I don't recognize, and maybe they're not so familiar with Ayurveda. And I did advertise this talk on Facebook, so it may have gone out to people who have tinnitus but have no notion of what Ayurveda is. So before I introduce the Ayurvedic doctor, Dr. Rajvinder Kaur, I'll just give a little brief explanation of what Ayurveda is, and apologies to the people who know a lot about it already, but they'll just have to bear with us for a minute or two. So Ayu means lifespan, and Veda means knowledge. So Ayurveda means the knowledge of lifespan, and it's reckoned to be one of the oldest traditions of natural healthcare in the world. Its roots go back thousands upon thousands of years. And essentially what it does is it sees health in terms of balance, and it sees ill health in terms of imbalance. Okay. And actually, if you look at the word disease, as we say we have a disease, but if you look at the word itself, it's dis-ease. The system is no longer at ease with itself. That's what the word means. Okay. So maintaining a state of balance through many different things is a way of maintaining health. But if your system goes out of balance for whatever reason, then that then manifests itself in various different ways, in various different conditions that are there, you know. What are we actually trying to balance, though? What is Ayurveda looking at the balance? And one of the fundamental things in Ayurveda is that it recognizes that we're all not the same, that we all have different natures, and what suits one person might not necessarily suit another person. And what Ayurveda does is it categorizes people into three main body types, or doshas is what they're called. So one is Vata, one is Pitta, and one is Kapha. If you're new, don't worry about this, okay? I'll just briefly say what Vata, Pitta, Kapha are. Vata is air and space. People who are very Vata tend to have a thin frame, a very quick moving mind. They can, if there's too much movement, if there's too much of that Vata in their system, that can manifest itself in many ways, like insomnia, in anxiety, in tinnitus. It's one of the an increase in Vata in the body is responsible for that. Pitta is the fire element. Too much of the fire element can give rise to things like liver problems and eczema and skin problems. And Kapha is the earth element, which is the heavy element. Kapha people tend to have a very strong metabolism. They tend to have a very strong immune system. They don't suffer from very many sicknesses, but some of the more nasty ones, like depression, would be a Kapha thing, and obesity also would be a Kapha thing. So we're bringing balance into our life through all the things that we do, through the choices that we make, through our diet, through our lifestyle, through our sleeping patterns. And essentially what Ayurveda is, it's a prevention orientated system of health, because it sees that if you prevent something from happening, you know, if you maintain balance in your life through proper diet, through proper sleep, through appropriate exercise for your body type, then the chances are, you know, that you can maintain a healthy lifestyle, you can maintain health, and you won't suffer from these problems. And by doing the wrong things, by maybe eating too much processed food, by too much screen time, too much activity, and not enough proper sleep at nighttime, no way of coping with stress in a good manner, then the system goes out of balance, and that imbalance manifests itself in many different ways in different people. So essentially what Ayurveda is trying to do is for you to understand your nature and to realize what things in life bring balance to you and what things can put you out of balance, so you can avoid doing the things that put you out of balance and do the things that keep you in balance. Now, unfortunately, in the world that we live in, we don't tend to think about our health too much until we begin to lose it. Now, that is starting to change, I think. Younger people are getting more interested in what they eat and doing proper exercise and doing yoga and all these things. But in general, I'd say it's still probably fairly standard. People don't really get too worked up or too concerned about their health until something happens. And then obviously at that stage, you're progress down the road of some disease, some symptoms are beginning to show. And it's always a little bit more difficult to reverse things when they've started to manifest, or needs to be a little bit more work done. And that's why you might see an Ayurvedic doctor or whatever to help bring you back. So what we're doing, what we're looking at tonight, is the Ayurvedic perspective on tinnitus, what might cause it to happen, and what the symptoms are, and what are the lifestyle changes and the dietary changes that you can do in your life that hopefully will help to reverse or lessen the disorder. What we're not doing is offering anybody a promise that we're going to cure their tinnitus. In actual fact, the strange thing about Ayurveda is that it doesn't really treat disease at all. It treats the person. The disease is always symptomatic of something else that's going on within the system. It's symptomatic of an imbalance. And what Ayurveda is, it's looking at the person, and it's looking at their lifestyle, it's looking at their diet, it's looking at their stress management, it's looking at their sleep patterns, and it's seeing where are these things going wrong, and what advice can you give the person, what changes they can make to help bring themselves back into balance. But unfortunately, it always puts the responsibility back on the person themselves, because even though Ayurveda can give you advice of the things that you can do, it's up to yourself to do them. So that's what we're going to be looking at tonight. We're going to be looking at this particular disorder from an Ayurvedic perspective. And the person who's going to do the introduction to this is an Ayurvedic doctor. Now, in India, in order to become an Ayurvedic doctor, it's a 6-year degree course. So you go to university after you've done your high school, and it's a 6-year degree course. And then after that, you work in hospitals or you work in different clinics. And tonight's presentation, the beginning of the presentation, will be done by Vaidya Rajvinder Kaur. Now, the word Vaidya means Ayurvedic doctor. So we can call them Dr. Rajvinder Kaur, call her Dr. Rajvinder Kaur, or Vaidya Rajvinder Kaur. But Vaidya just means an Ayurvedic doctor. Now, Dr. Kaur came to Ireland in 2007, and she has been working with the Ayurveda Centre ever since then. She's a very, very experienced Vaidya. She's in big demand. She travels to the UK quite regularly. She was in Glasgow recently doing consultations. She was also down in Rendlesham in southern England doing consultations down there as well. And she travels to many different centres around Ireland as well. So she's a very experienced Ayurvedic doctor. She has had experience of dealing with this particular condition, as have all of our Ayurvedic doctors. So I'm going to hand over to Dr. Kaur and to do this little presentation. So Rajvinder, you can go ahead. Thank you very much. I can't hear you, Rajvinder. Oh, you're okay. Sorry, you must have gone on mute again. Okay, you should be able to unmute yourself.
And if you allow me to share screen as well.
You want to share screen as well? Yeah. Okay.
It's just I have a little Word document. I think it'll be easy while I'm speaking.
Okay, you should be able to share now.
Yeah. So thank you for the introduction. That's a very good start for people who are new here, but I think most of you are familiar with the basics of Ayurveda. The basic foundation is your body type. Once you understand that, then you understand the imbalance, and then some of the Ayurvedic strategies you can work at home, or you can work with the Ayurveda practitioner to bring the balance. Okay, so I'm not able to share screen now, still disabled. So I'm just starting very simple introduction. I'm not using too much detail about it. So we will quickly look at what is tinnitus and what causes it, some of the basic things, and how Ayurveda look at it when you are trying to treat it. So what are the strategies? So just simple, a short one, not too long either.
So you should be able to share, Rajvinder.
Yeah, thanks. So just a little Word document I have. So so I'm sure everybody can see that. So tinnitus is known as Karan Nada. So that is the Sanskrit terminology in Ayurveda. So Karan means ear and Nada means the sound. So tinnitus is the sound that person is hearing. That's normally it is. So it is when you're experiencing ringing or any kind of noise. It could be one ear or it could be both of the ears. So the noise you hear when you have tinnitus is not caused by any external. It's not anything coming from any particular thing. You don't know where the noise is coming from. So mostly it is internal. So there is not any external noise that you're hearing. and other people won't be able to hear what you're hearing anyway. Sometimes it is not a very subjective, and your doctor through certain instruments, I think they can hear the tinnitus. So it depends on the type of tinnitus that person is experiencing. So symptoms could be, as I said, ringing in the ear, even though there is no external sound present. It can also be caused by other type of noises like buzzing, or some people say it's like a bee is kind of buzzing around, or a roaring sound could be there. Or one of my patients described one ear has a different sound and other ear has totally different sound. So it could happen that as well. A clicking sound could be there, hissing sound could be there, humming sound could be there. So it could be different type of sound. There is no set pattern. And for some people, sound change as well. It not always is like a buzzing sound or ringing sound. It could be different. So there is always a reason for it. And that's what we should look for. Tinnitus does not present itself. It is a symptom of either something imbalance is going to happen, or some other problem is there, imbalance is there. So as a symptom of that particular issue, tinnitus is here. So normally there is a medical cause of it. So if you are any one of you is experiencing the tinnitus, and I think it is the first 3 days once the tinnitus happen, and you immediately go to the doctor and they check it, and they can prevent it to go turn into chronic. But I think more than 3 days or a week, it is given as a name chronic tinnitus. And it can happen with somebody, like you are out in a concert with a very loud music, you're exposed to some loud sounds, and you're feeling a little bit off afterwards, and you think, oh, it's just because I was in the concert, and it is not going away next day, it is not going away the following day. Then you immediately take action. You don't ignore it, because that could be the damage to the auditory nerve, which is the nerve that is in the ear, helps with the hearing and conduction of the sound and all that stuff. So if the nerve damage is there, the tinnitus can happen. And it could be very common in people like construction worker, the road worker, where they're using very heavy machinery and a lot of the noises is come. And I have seen in most of people, they don't wear any protection. They don't wear their headphones, even they might be given. And it's just like, oh no, I don't need it, I'm fine. But that could damage the eardrum. And once the damage is to that level, that is very chronic tinnitus, and that could be a bit difficult to treat or may not treat. And that as a consequence, it keep on going, and it turn into hearing loss as well. So if anybody is in construction work or dealing with like a DJ music sounds, they should have some protection. So lack of protection, lack of protecting your ears is one of the biggest cause of tinnitus. And you are living somewhere like your house is by the roadside and the traffic is all the time heavy and busy, so then you need different kind of windows to soundproof in the daytime, so things like that. So this is very common cause of tinnitus. So other number of underlying health conditions could be there, as I said. So for example, sinusitis, if somebody has a chronic sinus problem, that can give birth to tinnitus as well. So the first thing is you see, oh, I don't have any allergic rhinitis, hay fever, or sinus problem, which could be a long-term lead to tinnitus. So the first thing is you treat that and don't ignore any sinus. They could be very serious. Exposure to cold wind, like in Ireland, the weather is always cold, especially people living on the hilly areas. And some of my patients, like Waterford, people tell, oh, it's always windy. Sligo people say it's always cold. So temperature play a big difference, environment, the nature play a big difference. So especially in the autumn when it's very windy, don't go outside with your ear not covered. So we always say that to people in a windy day, if it's better not to go out, but if you want to go for a walk, make sure you cover your ears, because ears are the organ of vata. And it is a big vata imbalance, which I'm coming to it later. So you protect your ears from either by headphones or headscarf or piece of cloth or something, whatever way, if you can protect your ears. And people who are swimming throughout the year, especially in the winter time, some people swim and then they might complain of tinnitus as well. So it may not happen, depends on one person is very strong pitta person and that person is not complaining of tinnitus, and one person is very vata person and vata person wouldn't complain of tinnitus. So it varies from person to person as well. And then if you are somebody always poking your ear with an earbud or finger or something, because anything that is going into the ear, it is a foreign object, and your ear will try to protect it by producing extra wax or some other action of your body against that object that you keep on putting into your ear. And some people will have too much wax production, and too much wax sometimes can cause tinnitus as well. So if you have a habit of always doing that, so don't do that. And hearing loss, as a consequence of hearing loss, it could be tinnitus, or because of tinnitus, it could be hearing loss. So it's both way. And ear infection, yeah, some people like kids, if there's a history of recurrent ear infections, too many antibiotic exposures, and then there is some blockage in the ear canal, that can cause tinnitus. Head or neck injuries are a big one. Some people wouldn't even know they had a whiplash or some neck injury or wear and tear in their cervical area. That is a cause of tinnitus as well. So tinnitus appear like they had an accident, injury, something in a year or so, the tinnitus appear. So you don't need to treat the tinnitus, then you need to treat your neck. And that injury, strengthen the cervical area, regular physio exercise, craniosacral therapies, head massage, and things like that we look into. Certain medication have side effects which lead to tinnitus. So you need to check that any of the medication you're taking is not causing the tinnitus. Ear bone changes. There could be degeneration in the ear bone and they are rubbing against each other. That is causing tinnitus. Muscle spasm can happen in the ear to lead to tinnitus. The TMJ, your jaw joint, if there's any problem in that can cause tinnitus. A blood vessel disorder, high cholesterol, these things cause tinnitus. People with high blood pressure can have a hissing or a pulsating sound in their ear. People who are into roller skating, that kind of sports, or spinning exercises, they can increase vata, because with the roller blades, you're exposed to that constant sound. And if you're not protecting yourself while doing roller skating, or your posture is not good doing roller skating, that can give birth to tinnitus over the longer run. IT professional people, they are constantly exposed to headphones, earplugs, or they have to use that kind of something, Bluetooth or things like that to hear, and they could be working for 8 hours or 10 hours a day. And that is, I have seen in IT professional people, they have tinnitus. And other chronic condition, diabetes, thyroid problem, migraine, anemia, B12 deficiency, and some autoimmune problems can have as a side effect tinnitus as well. So that is a symptom of disease. Like diabetes can lead to weight loss, and as a weight loss, vata increase, and tinnitus can happen. And tinnitus could also be psychosomatic causes, like there is no medical cause, your doctor has checked you for everything, nothing finding out. Then you also look into, is there any psychosomatic cause, like childhood trauma or suppressed anger, like you're in an environment where your partner or somebody's constantly negative, nagging at you, and you're trying to block that outer noise, and then your body start giving you internal noise in the form of tinnitus. So that's your mind is trying to deal with the situation rather than suppressing it. So in that scenario, yes, you need to address that trauma, you need to address that emotional issue, relationship issue, whatever is going on because stress is a big cause of tinnitus. And so it could be very much of psychosomatic as well. And then a few things on the dietary can play a role. Like Noel mentioned something, vata. Vata is air, and air is dry, air is cold, and air is irregular. If somebody's eating regular dry food, like too much of dry food, like there's a lack of healthy fats or there's a lack of nutrition, and food is cold, there's no warm food, cold water and cold food, that can also lead to increased vata in the body. And increased vata will affect all the vata organs. One of the vata organ is ear. And then heavy exercise, you are a very skinny person and you do too much heavy exercise that I mentioned. Spinning is one of the very considered vata increasing exercise that can cause tinnitus. Or a wrong type of exercise for your body type, like you are vata person and you're doing totally wrong exercise for your body type. And too much exposure to cold and air, we said that already. Nowadays, there's a trend of cold showers and cold water, this and that. But vata people have to be careful around that as well, not overdoing cold showers. Yeah, cold shower in moderation are good to stimulate your vagus nerve, but don't overexpose to cold temperature. And if you're a lecturer where you have to talk and talk and talk, that can also cause tinnitus, because too much talking creates the space, that hollowness, that emptiness in the brain, and the sound can take place there. And the vata food, irregular, you're not regular eater, you're not regular sleeper, you have a very irregular lifestyle, that can also cause tinnitus. This is very common with tinnitus people. They don't sleep. There's a chronic history of insomnia, or people say, oh, I go to bed midnight, or I can't sleep, I go to bed by 2 a.m., something like that. Those people definitely have tinnitus. So sleep is a big one. And if somebody has tinnitus, the first thing they need to resolve is the sleep. And overconsumption of bitter food and estrogen food can also increase vata. And you probably have heard over and over the six taste in the food, and the sweet taste and salty taste. They are quite grounding taste and quite lubricating taste. So they balance vata. But the bitter and estrogen taste will be very light taste and promote dryness in the body. So they could increase vata, like overconsumption of coffee and chocolates, or too much of any warming spices, chilies, and things like that. They can also cause a tinnitus. Okay, so these are some of the very common causes. And as a tinnitus, what complication could happen? Tinnitus could be, with a person, when they have tinnitus, they're very anxious. In the early days, it caused a lot of anxiety and a lot of fear. So it could be very debilitating condition. It could be, it's not life-threatening, but it could, if it caused that much stress. So it will affect different people differently. It could significantly affect the quality of life. If you have tinnitus, you can also experience fatigue, stress, sleep problem, trouble on concentrating, memory problems, depression could be there, anxiety and irritability could be there, headaches could be there, and then the work-life balance could get affected. So these are some of the complications. And that's what, if the tinnitus is here, don't panic. I know it is very frustrating situation to hear the noise, to cope with the noise, but it's, and don't have that kind and that idea in your head, like your doctor tell you, oh, you cannot treat it, it's untreatable. It's not true. If you find out the reason why I have tinnitus and you deal with it, and with the proper training of the brain, which is TRT therapies and some other things, you can manage the tinnitus much better, or in some cases you can even reverse it. Again, it depends on how chronic it is, how much damage it is there, what is the underlying cause of it. So, and then I come with some solution around lifestyle and diet and herbs. That's what we are looking into next. So lifestyle changes, as I said, it could be, I think it start as you're exposed to some loud noises. Could be your young age that you were exposed to very loud noises, loud music, or somebody like nowadays teenager, they have headphones on, they all the time constantly listening to music and stuff like that. So that is like overuse of your senses. So one of your sense, like ear, you're overusing it, and over the time, of course, it's gonna go weak. So you need to avoid overusing of your senses, especially your ear organs. When you're traveling in a vehicle, especially on motorway or something, try to keep the window closed so that you're not exposed to that loud sound that come from your tire going on the road, or from other vehicles, especially if you're in a country like India where all the time beep, 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 and too much loud noises. So you need to protect yourself from that kind of noise. And use headphones if you are in a construction area or some other protection gear there that you're given. When you're surrounded by loud noises like a sports event, club, and definitely wear ear protection. If you are a Vata person and you don't have tinnitus, I still advise you to use ear protection anyway as a prevention. Okay. And other thing is the stress worsen tinnitus. So management of the stress is very good. So regularly practicing some relaxation techniques like deep breathing, gentle yoga posture, because tinnitus could be wrong body posture. Like some postures are causing some issue in the spine, and because of that wrong posture, tinnitus is here. So some gentle yoga posture, physio exercises can help you to correct the balance in that area. And meditation. And stress management in patient often result in the decreasing in the noise, the loudness of tinnitus, or sometimes it cure it as well if it's very much psychosomatic related, especially in men, because they suppress their emotions a lot and they don't tend to cry because that's the pressure is put on the men. Oh, come on, you're a boy, you don't cry. And then as a consequence is you start suppressing your emotions and you don't express yourself enough in a stressful situation. So Ayurveda encourage you to not to suppress your urges. If you have an urge to cry, do cry. And that sometimes, because cryness would clear all of the sinus and lighten up the pressure in your ear, and that will help with the tinnitus if you are in that situation. And also Ayurveda, I have spoken about it somewhere in the past lectures. Don't suppress the natural urges. If you want to sneeze, you're in an environment and we try to suppress that sneeze, and that sneeze can cause vata imbalance, suppression of that sneeze. You want to cough, don't suppress it. So we should not suppress those kind of natural urges either. And also depends on what's going on. You might need to see a psychotherapist, might need to consider counseling. If you're carrying a deep-seated trauma and you have done other things, nothing is working, then you also need to open to counseling as well, because one of the main reason of chronic vata imbalance is childhood trauma, which is very common in every culture. The trauma is there, could be childhood trauma, relationship trauma, work-related trauma, anything is there. If that's what you're carrying, and that is your mind is constantly nagging at you, and that nagging, that talking, that chatter brain is causing the tinnitus. So you better resolve that. And suppress anger. You are in an environment where you're angry, but you can't show it. You can't show it to your family member due to whatever situation. So you need someone you can go and talk to. It could be a friend or it could be a therapist, which is a very neutral relationship. And for those who experience tinnitus while sleeping, you should have the one thing with tinnitus is you should avoid silence. You should not practice quietness, like a complete silence, because then tinnitus get worse if you're in a silent environment. So in your bedroom, always have some kind of nature sound. Like some people keep the fountain kind of sound or little fountain in their room, that you can get those Buddha electrical fountains that you're hearing. You divert your brain hearing to that sound. Or especially now in a summer day, you keep your window little open that you can hear the nature sound of the wind. You might have a tree in your back garden where early morning the birds come, or chirpings of the leaves, and something that you're hearing. So always give your brain to hear to something else other than the tinnitus sound. Then your sleep is better if you suffer from tinnitus and the sound is not letting you sleep. And fan of radio, or you might be, your room is near the kitchen where you can hear the sound of fridge or something else. So it can help to relieve the budging sound from your ear. Smokers and alcoholic people are high risk of tinnitus, so you better quit it. Try to quit it. And also take care of your cardiovascular health, because heart health is very important, because that's the circulation of blood to your ear and all the other organs. So look after your heart. Regular gentle cardio exercises will be good. Eating right and taking other steps to keep your blood vessels healthy can help prevent tinnitus, like obesity or cholesterol issues and things like that. And aim for good night's sleep. If sleep is an issue, resolve it. So general advice, we have spoken so many times about sleep, but general advice which I mentioned here is routine is the key. Make sure you go to bed on time. Right? Like Ayurveda say, your bedtime is 10 to 6. So you are bed in by 10 and you up 6 or 7 at least in the morning. So that routine of going to the bed slowly help you to get a better sleep. And if you're eating something heavy in the evening, you're not going to sleep by 10, or your sleep is very much disturbed, or you're drinking too much fluid in the evening, it's keeping you awake. So make sure your dietary stuff is okay, and avoid any strong thrillers or action movies or stimulating programs in the nighttime, and your gadgets and sharp lights. And also, if you're somebody who are tired in the daytime, try not to go to bed quickly. Unwind yourself before you go to bed, because that gives break to your brain from that tiredness from the day. You can do maybe a little abhyanga, which is self body massage or feet massage, some breathing exercises, body scans before you go to bed, or read a light book that will help you to go to sleep as well. Okay, so, and people with tinnitus, I recommend listening to maybe white noises or pink noise. There are two types of noises that help with the tinnitus. So white noise will help with the people who are not sensitive. Like there are some people who are very extra sensitive, like vata people could be very sensitive. So if you are a person suffering with tinnitus plus extra sensitivity, then you listen to the pink noises. So you can research more about it, or get in touch with a TRT specialist who do this training of the brain therapy, where they train the brain to listening to certain frequency, and then the brain is exposed to this sound, some danger, the brain sends some fear. That's why brain is throwing these tinnitus sounds at you. And to get the brain out of that fight and flight mode is to train the brain to listening to white frequency noise or pink frequency noise as well. Okay, and follow Vata balancing routine. I hope at this stage you all understand Vata, and Vata balancing routine is you do Abhyanga, you do grounding, you eat your main meal in the middle of the day, and you take a little nap in the afternoon, and you don't expose yourself to too much of stimulating activity in the evening, and go to bed by 10, your breathing exercise, all that's Vata advice you follow. And Vata diet as well you follow, where you don't eating too much of cold food, skipping meals, eating too fast, everything grounding, grounding, grounding. And if you are near forest, go for forest walk, listening to the forest music, forest bathing, sunlight, all that could be very helpful as well. So these are the general kind of recommendations that you can do. And then general dietary advice is balancing diet is very good to keep your dosha, like whatever body type you are, which we call dosha. So follow that diet and lifestyle advice around it. So that balanced diet is very good to treat any disease anyway, and to keep the proportion of dosha, to keep the proportion of air in your body to the level what you're born with. And then plenty of fresh fruit, fresh vegetables, as much as organic as possible, because this pesticide, fertilizer, these things can also affect your nervous system, and weak nervous system cause tinnitus as well. And omega-rich food like nuts and seeds and healthy omega oils, and avoid red meat. You can have white meat if you eat meat, then chicken, turkey, mackerel, oily fish, that kind of food could be good for you. So, but avoid tin kind of fish, because tin fish have no omega in it. It's really nothing. So buy a good quality fish. And avoid fried food, sugar, gluten could be a problem. So dairy could be a problem. So you look into that as well, that you are sensitive to gluten or sugar or fried food. Alcohol and smoking, we already said that. And coffee could be a big stimulant for Vata people. So avoid or reduce the amount of coffee and tea you're taking. And the food that irritate your nervous system, like sugar could be a big irritant to your nervous system, heavy metals, which is tin food, aluminum, and that kind of food. Or make sure your water, you're using a good quality water that doesn't have a lot of metals in it. You don't have mercury fillings in your tooth as well, because sometimes the mercury dental filling can cause tinnitus as well. And the potassium-rich food, the research say the potassium-rich food help with the tinnitus. So potassium-rich diet like pineapple, banana, cucumber, coconut, and the list is long for potassium-rich food. So seaweeds and things like that, they're also very good with the tinnitus, because potassium deficiency can cause that weakness in the nerve sheath. And B12 is another supplement. People deficiency in the B12 could have tinnitus. So because the myelin sheath, which is the protective sheath on your nerve, is nourished by B12. So especially the vitamin B12 folate is very good to have from time to time. If you're vegan and vegetarian, you definitely need that. Vitamin D deficiency is very common nowadays, so make sure you have vitamin D. And then two type of food that you avoid: oxalate rich food and tyramine rich food. So tyramine is like histamine kind of food, which is too much of fermented yeast based fermented food, or nightshades, or apples and chocolates and raisins and avocados. If you have very bad tinnitus, you avoid these kind of food. You can search about it. The list will come up for you. Tyramine rich food. People with tinnitus should avoid oxalate and tyramine rich food. Okay, so you would just think, oh wow, raisin. Oh yes, raisin can cause sensitivity, and then it can increase the tinnitus. So how Ayurveda treat tinnitus, what we have to offer, because Ayurveda is a very much of a prevention model. So it's like increase like, and opposite is the balance. So as I said, it is a very much of a Vata imbalance, which is dryness. And if it is a Pitta imbalance, that will be inflammation. So we'll be trying to lubricate the ear by lubricating the body through healthy fats, or some local massage or oil application. And then if there's inflammation in the body, then you're treating the liver and anti-inflammatory diet, and you're balancing the Pitta. Kapha mostly will be sinus issue, because Kapha people in general shouldn't have tinnitus, because they are very grounded people. But due to their lifestyle or some reason, if they have tinnitus, then that could be extra mucus, or that blockages in their ear canals from extra wax or heaviness and dampness. Then you treat that. Okay, so it could be an individual approach. If you're very much Vata person, then you will be treated for Vata. If you're a Pitta person, then you'll be treated for inflammation. And if you're a Kapha person, you might be treated for sluggish metabolism, constipation, thyroid problem, diabetes, that kind of issues, which are more common in Kapha. So let's say the Vata. Vata is a controlling dosha of the ears, and Vata pacification treatment is indicated, mostly Vata pacifying treatment. If there is any medical issue like ear infection or eardrum is burst, perforation is there, then of course you need to consult your ENT specialist. Then that all should be ruled out before doing any Vata, any Ayurveda advices. But what are the more safest thing to do is if your cholesterol level is normal, then you eat a bit of cow ghee, ghee, which is clarified butter from grass-fed cows in your food, in your cooking. You can put a little bit into your milk if you're taking milk, or putting coconut oil in coconut milk, using olive oil in your salads and foods, things like that. And then there are medicated ghees, like on our website you can see Brahmi Ghritam, which is made from herb called Brahmi, and it is with the ghee. So that could be very good as well for Vata people with sleep problem or dryness or very busy mind. So Brahmi Ghritam is very good. And Rasayana, which are antioxidants. So regular use of some of the antioxidant, for example, Amrit Kalash or some other Rasayana we talk about, like Amla berry, things like that. And oil, applying the oil, massaging the oil onto the ears. I'll show the picture later what oil I'm recommending, Bilba oil or Brahmi oil, things like that. And treating the underlying cause. So once you find out what is the cause, you treat that. If you have high blood pressure, you treat high blood pressure. If there is a neck injury, head injury, anything like that, you treat that with oil application, some other treatments. And yeah. And then other Ayurveda therapies for tinnitus is, first you get a proper assessment with your Ayurveda practitioner or you from your GP as well. So you both doctors are in line treating with this. And then if you can find out if there's any medical issue, definitely need to treat the medical issue as well. Or if it's psychosomatic, then you take the help of yoga, meditation, counseling, things like that. Other things like you clear the sinus infection by regular nasal saline rinse. You can easily get those saline rinse in the pharmacy, or you can, or if there is an extra production of wax, your ENT specialist can check. You say, oh, all of a sudden I'm not hearing, so you need to check yourself from wax, because sometimes wax could be in the way, and that can cause the way it is around the eardrum, that can produce noise as well. Ear flushing can be done. Some people will be trained to do the ear flushing with the help of an ear bulb, but I don't suggest that you do on your own. Make sure you're properly trained to do that, or if there's any perforation, you don't put anything in the ear. Ear infection, you don't put anything. So some of the simple therapies that we do is called Karna Purna. So some of my patients are like, they are trained to do that themselves, and they do at home for themselves, family member, like they're fully confident about it now. So you take oil, like the way it's a little oil in a little dropper kind of thing. It's a warm oil, and then your ear canal is filled with the oil. So you see in the picture, the oil you can see on the outer surface. So you fill the oil ear with the oil, and you leave it in for 2-3 minutes, and then by tilting the head, you take all the oil out. So what is this doing? If there's a dryness, because there's a degeneration in the ear bones, and because of degeneration, the tinnitus is happening, or there's a sinus cavity inflammation, because of that tinnitus happening, this will immediately resolve the sound for at least for an hour or two. And if you get that result, then you know, oh, there's a lot of dryness in my nervous system and in my ear bones and things like that. So then Karnapurna, oiling the ear, is the answer. And then if you're somebody who have a lot of stress and anxiety, and the brain is very active and sleep problem, then the treatment called Shirodhara, which is the pineal gland, your third eye, the oil is flowed in a stream to the third eye, and then it is followed by head, neck, shoulder massage. That's again very relaxing treatment, and this also help, very good tool in the management of tinnitus. And then what you can do at home, because you cannot do Shirodhara at home, then you do Shiropichu, which is you soak a piece of cotton or a little piece of cloth of cotton with oil, especially like Brahmi oil, and you put on the top of your head and then leave it on for 20-30 minutes. And because that's one of your marma points, energy point, the oil absorb, and it gives lubrication to your whole of your nervous system. It's very grounding treatment. So that also helps with the tinnitus. So this is the very simple. And as a side benefit, these treatment also help with the weakness of nervous system, insomnia, thyroid issue, any other problems as well. So this is not only for tinnitus. This treatment is like oiling, lubrication treatment. So they have a lot of other benefits as well. And then herbal preparation. So these are, I just picked one that is available on the website, but there are so many different herbal preparation that are given for tinnitus. So bilva oil that you saw in the picture, the filling the oil with the ear with the oil. So bilva oil is recommended because bilva is very grounding herb and it's very lubricating on the deeper level. So you can use this oil. And then if you are somebody with a sleep problem, then deep rest, or it's also called blissful sleep herb, is very good. And then sinus issue, if there is a sinus problem, then MP16, it could be used. But the other herbs like, which I'm just going to say, you might need to consult your Ayurvedic practitioner before using what herb is appropriate for you, for your body type, like ashwagandha, or amla berry, or some of the other rasina, or some other vata balancing you need. So there are a lot of different herbs there. So some single herbs like bala is very good, which you can use a teaspoon of bala in a decoction or in milk or whatever, ghee. Sariva is very good as well, especially if it's a pitta person and there's a lot of inflammation. Sariva, amla, and licorice could be very good. But in the combination of bala, sariva, amla, those 4 herbs could be very good for vata pitta. And then self-ear massage, you can do it yourself, which is like there are a lot of marma points around the ear even. So ear massage is very good. I mentioned craniosacral. If you know a craniosacral therapist, you go to the craniosacral, and regular craniosacral thing is very good. It's just the wrong there, craniofacial. It should be craniosacral, this typing error. So self-ear massages, I just given you 3 points here. So this is the Krakatika marma, which you see in the second picture at the base of your head, where the head meets your spine, that the marma. So you press with your thumb and you kind of do 21 circles, and you can just do that. It's very relaxing. And it's also related to gallbladder and liver point as well. So it also work on that area. So you just do kind of 21 times. And then once you have done that, then you come to the Shankamarma, which is temple area, where your eyebrows end and kind of go into the little groovy depression, dimple thing here. And that's the Shankamarma. So you can either use your thumbs, and then you can put your hands like that and you go. So 21 clockwise circles you make. And you can use a little oil, like you can use bilva oil, you can use brahmi oil, even you can use sesame oil to do that, so that there is a little bit of oil in your hands. And because sometimes the pressure in the temple area, especially if you are somebody who suffers from migraine and headache, this marma is very good to relieve that pressure. And then 3 points on your ear. So just at behind the earlobe, that's called Karanamula. Karanamula is the root of your ear. So the root of your ear, that's 1. Again, you can use the index finger, the tip of, and then you make like press and release, press and release. You might feel a little tickle inside your ear actually, or in your jaw. That is telling you, oh, there is stiffness in my jaw. So I need to do some jaw exercise or jaw massage. And then in the picture, if you say, where your neck, that bone here, I don't know if I can show, here behind the Karanamula, which was the root of your ear. And if you move 3 fingers backwards towards your hairline, 3 fingers back, that is the Karanamula 1, which is the root 1. And if you move slightly up, that is the Karanamula root 2. Okay, so these are the 3 marma points which are very good. So one on the earlobe, and one behind the earlobe, and one just 3 fingers away from the behind the earlobe. So yeah, you can look for the Karanamula 1, Karanamula 2. So even just massaging though, like 21 on your Shanka temple area, 21 on your base of neck and your head, and then just like earlobes, and then behind the earlobes, and 3 fingers above the earlobes. So you just do that massage. And then there's another wonderful massage, which I couldn't demonstrate here, but I'm going to explain it to you. You put a drop of bilva oil and you put your fingers not too deep, very superficial, and you make a cross, like you depress the roof, the floor of the ear, lift the roof up and pull the lobes out and this inside. So it's like up, down, left and right. So you're making a little cross. So what is that doing? It's creating a bit more space. You're allowing the ear to expand the ear a little bit. You're allowing a little bit more space. So you can do it maybe 5 to 10 times. And that is actually very, very relaxing. And it does help if there is any tension or stiffness or muscle spasm or anything like that is happening, it relieves that. Okay, so I think that's the end of the this thing. So yeah, so I hope that has given you a little bit more insight into the tinnitus. But if somebody is suffering from tinnitus and say, oh, it's so many years, it's not going away, it's not curable. First of all, you need to get out of that mindset that it's not curable. You can definitely manage it better. As I said, look into TRT therapy, pink noise, white noise. Don't practice complete silence. You have to have a noise enhancement, something in your house, in your bedroom especially. And vata management, you need to manage vata. If you don't understand vata, you take up the 7-lesson free course and understand the vata a bit better. Follow the vata balancing diet, which is more about healthy fats and grounding lifestyle practices. If you're somebody with a very stressful job or stressful environment, whatever, you need to deal with that as well. And then simple therapies, wherever you are, you might be able to find either the practitioner or either the therapist. If that's not available, craniosacral therapist, reflexology, whatever you can do to manage the vata. So these are the simple kind of basic things. And then there are lots of nerve tonics, like I said, a simple thing easily available. You can put in your porridge, like maca powder, which is in your health store. Ashwagandha is nowadays very, very common, but ashwagandha is an adaptogenic herb, so you need to be slightly careful when you start using it, and then it slowly adapts to your system. It sometimes doesn't suit everybody, so that's what you need to monitor it a bit. Brahmi, gotu kola, these are the other adaptogenic herbs as well. And yeah, ginkgo biloba is kind of Brahmi as well. So different type of Brahmi is there. So look into nerve tonics. If you're somebody after 60 and 70, Youthful Mind is a very good preparation. It's on the website, just to strengthen your nervous system. But if you're someone young in their 30s and 40s, that is most likely a pitta issue that you're trying to deal with the stressful job or study or sometimes too much information is a problem. Like nowadays, we are exposed by this health information, this and that information, dietary information. So try to protect yourself from that too much information, because sometimes your brain, like it's a little animal, and it is trying to be that extra sensitive to hear the noise of the predator. And then that bird, that little animals in the fight and flight, and couldn't hear anything else except just that noise of that predator. So then your brain become extra vigilant. So when we are in a danger of fight and flight, that's what our brain do to us as well, that you're hearing this noise, but that is masking of something else. So that's what you need to see as well. What do I'm trying to mask? Okay, so yeah, so I'm just going to stop it here. If you have questions, or I was talking to one wonderful lady on Friday last week, and she's suffering from tinnitus, but that's not why she came to see me. She just said, "Oh, that doesn't bother me anymore." And I said, "How?" She said, "It's my attitude, the way of me looking at tinnitus. It has helped me to cope with the tinnitus." She was like, it comes with many gifts. That's what I'm not saying that tinnitus is a gift, but it is trying to tell you that something you need to address, there's something deep is going on. And a lot of the time it could be psychosomatic as well, that you need to look into the stress, because we all are in fight and flight. And if you learn to live in rest and digest mode, I think tinnitus, the intensity of the sound could go down. And then all these preventive measures that I have said, you can take those. Sleep is a big one. I think 70% of people nowadays don't sleep very well, or especially the young people, they go to bed very late. And later on in the life, the vata is rising. Vata is not something that's going to go out of balance in one day. It is a buildup. It is a buildup in 6 months, 1 year, or 10 years. After 10 years, somebody's having tinnitus because they were building vata from their bad habits, from skipping meals, even from drinking too much coffee or going to bed late. So it is an imbalance that you know why it is there. And once you understand why it is there, then you can address that, and you can slowly, if it took 10 years for your body to show that tinnitus, might take 10 years to resolve it as well. So it may not take 10 years, but staying hopeful, staying positive is the way forward with this. Yeah, it's a very annoying kind of a thing to have tinnitus, but you need to have a good attitude about it and investigate, try your best to find out why do I have it, and then go with a positive attitude to treat. Okay.
Okay, Dr. Rajvinder, that's fantastic. Actually, there's a huge amount of knowledge there, and we will send a recording of this to everybody. Well, we'll send it out in our newsletter and to everybody that registered for it. Actually, when I was looking at all the things you were advising there, like, I mean, Vata, for people who are not too familiar with Ayurveda, like there's 3 doshas, Vata, Pitta, Kapha, and Vata is the king of the doshas. It's the main, it's the one that leads, and it's also the one that's responsible for most diseases. Now, Vata is air and space. So you have to look at the qualities of air and space. Well, they're both very light. Air is moving, it's drying, and it can be cold as well. So those are the qualities of Vata. And those things in life, in Ayurveda, we treat with the opposite. So if you want to treat cold, you introduce hot. If you want to treat dry, you introduce moist. That's why something like an Abhyanga, a warm oil massage, is really, really good for Vata people. Now, Vata is responsible for most diseases. It's the king of the doshas, and it also has most diseases associated with it. And your Vata time of life is over when you go into your over 50s. But as Rajvinder said there, it's not that Vata disorders just happen overnight. They take years and years and years to build up. And the time we need to be addressing that is by having good lifestyle when we're in our 20s and 30s. But we can adjust our lifestyles later in life to help balance that as well. And the ears are actually a Vata organ. So there was some few things I picked up there that are very important for people with tinnitus, that in the wintertime, wear a hat when you're going out. If it's cold and windy, wear a hat. A thing like an oil massage, a hot oil massage, is going to be very, very good for balancing Vata. Nice, warm, nourishing food. If Vata is dry, then eating a salad in the wintertime is not what you should be doing, because the salad is dry as well. But whereas a nice warm stew, a nice moist stew, nice warm vegetables, all of those things are very good for balancing Vata. And also routine, because getting out of routine, being too busy, being too stressful, all of these things increase your Vata. Now, Vata increases, along with tinnitus, it's also responsible for dementia, for Parkinson's, for arthritis, for insomnia, for anxiety. There's a whole host of disorders that are associated with Vata. And if you do those things that Dr. Rajvinder mentioned in the thing about having the good routine, about doing the Abhyanga, about taking the nice nourishing foods, to do some stress management technique if you're very stressed, to go for walks in nature, to get grounded, all of those things, not only may they have an impact on your tinnitus, hopefully, but they'll also have an impact on your overall general well-being and health. So all of those things that Dr. Rajvinder mentioned are going to have other side benefits. And as I said earlier on, it's not that Ayurveda is specifically treating tinnitus. It's treating the person. It's looking at the person and saying, okay, why is this happening to you? Why do you have arthritis? Why are you beginning to get dementia? Why do you have you got the start of Parkinson's? What has caused this to happen, and what you can do to hopefully help reverse it by adjusting to those lifestyles. And what I'll do a little bit later on is I'll share my screen and I'll show you where you can do a whole lesson on Vata, because for new people this is going to be a bit tricky, but we have a whole lesson that we've done on Vata and things that you can do to balance Vata, and a little bit later on I'll share that. But I see Dr. Brennan is on, and maybe he'd like to say a few words from his perspective there. Don, if you'd like to come on, you should be able to unmute yourself.
Thanks, Noel, and thanks,
Hi, Don.
Dr. Rajvinder. Lovely
Hello.
talk, very comprehensive.
Thank you. Thank you.
I just looking at some of the questions, Noel.
I'll go through the questions, Don. Is there anything in general you'd like to add to Dr. Rajvinder's talk?
There are a few home remedies there. Yeah, maybe you can say that.
What's that, Rajvinder?
Few home remedies like olive oil with garlic, and people do onion wrap, and yeah, I didn't go into that yet. There those things are there as well.
Well, I think you cover pretty well the various oil drops in the ear are very good, and the ashwagandha, the brahmi tea. I mean, these are excellent, so I'd go with them. I think that very many people will have tinnitus, and perhaps a small proportion will have a medical cause, and therefore, if you're troubled by the tinnitus, the medical, as Rajvinder said, is a valid strategy. Have yourself checked out. Could be associated with diabetes, heart disease, or some other condition. It's a side effect of many medicines, particularly anti-cancer treatments. Antibiotics are mentioned, and there's aspirin is something that can cause tinnitus, but usually the tinnitus clears when you stop the aspirins. But some other anti-inflammatories can also cause it. So it's worth the medical diagnosis so that you're not missing anything. People have mentioned in the chat acoustic neuroma, which is the cell covering the nerve swan cell for the eighth cranial nerve. It develops a little tumor. It's not cancerous in the extent of being malignant, but it creates pressure problems that can result in ear problems, hearing and tinnitus. And but there is surgical treatment for that if ever it became a problem. But for many, it's just a nuisance, but doesn't go much further. But they have an eye kept on it. There's also an arthritic condition in the little bones for hearing in the inner ear, the otosclerosis, that could warrant a treatment as well. I suppose what I might add to all that Rajvinder has said is that the nasal drops MP16, you take them up the nose, the eustachian tube connects with the middle ear, and so there's a route for the herbs in the oil to get to the area, and regularly doing that could anyway clear any sinus issues or any blockages in the eustachian tube contributing to tinnitus, and would just be another health regime that you would do daily, maybe 3 times when you get up and after meals, that you use the nasal drops for a couple of months, along with the herbals that Rajvinder has recommended, like the Youthful Mind, or the Peace of Mind is another one that has those herbs good for the nervous system. Yes, whether you should be using the eardrops, if you've got the all clear for your eardrum, then you could put in some of the eardrops Rajvinder's been mentioned, or even mustard oil, but something else you could use for that.
Okay, but people should check it medically as well, as you say, in case there is a perforation in the eardrum.
Yeah. In India, they even have special like hop ear candle, but they don't use that in India. The special leaves kind of wrap into a candle and they burn it, and then they expose the patients, kind of course, burning their hair and everything, all the care. They put that smoke inside the ear. That's also one thing that is practiced in India, and that smoke is also given to the nasal cavity as well, because that's as Dr. Brennan said, they are the sinus and your ear, eyes, and nose, everything is connected. So these are the other things that they do.
I think it's worthwhile recognizing, as Noel and Rajvinder has been pointing out, when you have something like tinnitus, you don't have an entity. It's not like you have a disease.
Yeah.
That you have a process, as Rajvinder said, that may have evolved over many years, and it came to a point of critical point where it manifests. But that process is ongoing, and that's why the Ayurvedic approach, which recognizes your nature and recognizes what within your nature is going out of balance, this vata movement issue, and the particular types of vata, there's one to do with the mind, where stress and strain and all of those issues contribute to the process that evolves into tinnitus. And another is Udana, another vata that is to do with making an effort, speaking. So people who are speaking a lot or who are straining, rushing, then, these are background lifestyle contributions. That's why Rajvinder was very comprehensive in pointing to various things like not suppressing the urge to sneeze or hiccup, and not listening to that loud noise, all of which would provoke this area particularly. And the various remedies of foods and herbals and oils that she prescribed are to help settle, but also the good night's sleep and the regular good diet, because they all contribute. There's no one cure, but you can affect those processes to bring them back towards normal, and it takes a little time, and then it gradually clears. So that's the Ayurvedic approach. It's not the magic bullet, but it's totally compatible with your medical approach, and very empowering because you do the most of it. Your Ayurvedic doctor is there to advise and can definitely give some specific treatments, like Rajvinder was talking about, nasal treatments or ear treatments, but you can do most of it for yourself. Sorry, Noel.
Okay, no, Don, sorry, no, that's brilliant actually, and like it's very, very much about the condition. Deborah, Lindsay, like which element energies are involved in tinnitus? So it's air and space are the main ones. There may be pitta there as well, but it's mostly air and space, and it's mostly a vata condition. So we need to learn to balance our vata. And as I say, there are many, many benefits, not just in relation to tinnitus, that comes from that as well. I'll show you where to get more information on that a bit later on. We'll work our way through some of these questions. Don't think we'll get to do them all, but we'll have a look at some of them. So Ifran says, how many people have you treated through Ayurveda? How many people have you treated through Ayurveda that have recovered from tinnitus? Well, me personally, none, because I don't do any treatments. I'm sure the doctors have, but there are like thousands upon thousands of Ayurvedic physicians, so they must have treated thousands of people over the years. I did actually have someone that I taught meditation to that initially found it quite difficult, because when they were meditating, they thought the noise got worse. But after a while, I only had to meditate for a short period of time. And after a while, it actually decreased on them in a big way, because obviously meditation is good at managing stress, and stress obviously puts your vata out of balance, So dizzy issues time to time, and I'm diabetic too. So again, dizziness would be a vata thing. So all of the vata advices that Dr. Rajvinder gave. Would you know if there's any correlation to having bipolar 1 tinnitus? I imagine there probably is, but Dr. Brennan, maybe you have.
I'm not aware, Noel, of any specific link between those two. And the other thing that just struck me was akasha is the space element is to do with the sense of hearing. So that one in particular, space and air elements, but with particular emphasis on the space element for tinnitus.
For tinnitus, yeah. So Kira says, my tinnitus is caused by an acoustic neuroma on one side. I'm wondering if this can be treated.
Dr. Brennan answered that already.
Okay, Dr. Brennan answered that. Okay. I've noticed that smoking can temporarily worsen tinnitus. Okay, Christina, well then you're being very self-referral there. You know what's causing
it's very good to keep a diary where you write down what worsened the sound, and then you try to at least eliminate those causes. That can help you to understand the tinnitus better. Sometimes certain food can worsen it, especially frozen food, preservative food, that kind of things, because this is all a prana area. If the food is not much in very low in energy, which is like frozen food or leftover food or something like that, your tinnitus could be worse. So it is a good idea to have a diary to record your symptoms when it is worse, after a bad night's sleep, after smoking, or something else.
After a night out, listening to music after a heavy night out, anything that stresses the system. Sorry, that was Christian, not Christina. Sorry, Christian there. And so if you know that smoking makes it worse, then you avoid smoking. That's
yeah, smoking really does.
One, So Gisela says, I'm 72, around 5 years, the noise in my ears started, like the sound of old TV screens when YouTube turned it on. The orthodontist pathologist said after a year of symptoms, nothing could be done due to age. Okay, well, as Dr. Rajvinder said, she wouldn't agree with that. So you just listen to all of the Vata advices that were given there and see, can you recognize any of those things in your life?
So that is a degeneration issue. So for degeneration, oil is very good.
Okay.
And I'm 70 and I don't think I'm old, Gisela.
Yeah,
So,
absolutely,
so
yeah.
what you do with that advice from your otolaryngologist, your ENT specialist, is to prove them wrong.
Yeah, that's a good idea. That's a good idea. So Rajvinder's recommending oils for the degenerative one there. My tinnitus always gets worse whenever I take antibiotics. Is this a recognized side effect? I don't know about that. Recognized
Could be
side effect.
certain medications have that effect on certain people. Absolutely, that could
Oh.
be possible. Yeah.
Okay. So Psalm 12 says Eustachian tube disorder, which I have, ear popper is very good, and our autovent balloons.
And add in the nasal drops.
And
Yeah.
nasal drops as well. Okay. So Fran puts in a link to Pink Noise on YouTube there. What about freeze and fawn, not just fight and flight?
Oh, another form of stress, and
Okay.
yeah, any kind of stress would be a killer for tinnitus. So you need to address that for sure.
So Irfan says, what do I find my body type? There's a body type test on our website. I see Nirek has put that in there. You can do that. That's just going to give you a guideline. What you really need to do is the 7-lesson Ayurveda course. I'll show you how to do that. And by the time you've done that course, you'll have a very, very good idea of what your dosha is, you know, what type of
It's
person.
a totally free course. There's no cost. We just put up to educate people.
Well, I did it during COVID lockdown. We did it about, I mean, we had about 25,000 people and we just recorded it and took the best of them. And I'll show you how you can do that course. But definitely by the end of that course, you can do that. It may be very obvious what type of person you are. Like if you have a very thin frame, if your mind is always moving, if you're, you know, rushing from here to there, if you can't hold on to things, that's a good sign that there's a lot of Vata in you, you know. If you're someone that gets angry very quickly, or you can't stand in a queue, or you're very impatient, or you're very obsessive, more than likely you have a lot of pitta in you. And if you're very slow and ponderous and maybe prone to putting on a lot of weight, or a very sturdy build, there's probably a lot of the earth element kapha in there. But that's just a quick overview of it. I'll show you in a few minutes how to where to find that course. Deborah says how to treat dryness in the nervous system. All of the things that Dr. Rajvinder just said there. Vata is dryness. So the warm foods, the oil massage, the staying warm, the nurturing yourself, the avoiding stress, all of those things will treat dryness.
Regular oil massage is very good. The Shiro Pichu that I show, that's also very good. And the good omega oils in your diet.
Okay, so Chris says, I love the taste of Cereva powder. Okay, Chris, that's good. Ifran says, so many of us suffering from this dreaded problem. Yes, my dad had it, unfortunately, long before I knew anything about Ayurveda. I remember when I was younger, he had that problem, and he used to listen to tapes. I think there were whale noises and all sorts of different things that he was doing. I told him we were doing this webinar on tinnitus, and I said, I said, you had it. I remember you had it as a child. I said, what happened? And he said, eventually it just went away. It just wore itself out. And I said to him, was there any side effects? And he said, yeah, I went deaf. You know, so that's not the best option for it. It's better if you can treat it so that it doesn't go to that level, you know.
Fortunately, I go to that one.
So Linda asked for the notes. Sure, we'll send out the notes, Linda. I'll be sending out this recording at the weekend. Just give me until Saturday on our newsletter. Any of you that subscribed from a Facebook ad, I have you on a list and I'll send you that. The rest of you must have got it through our regular newsletter that I send out, and I'll send out this this recording plus the notes on Saturday, you know. So Vina says, thanks for the detailed explanation of tinnitus, Dr. Rajvinder. What about Ginkgo Bilbao? I think that was one of the ones you mentioned, Rajvinder, was it?
Yeah, that's fine. Yeah, any nerve tonic, really, if it suits you, that's all you need to know. Is
okay.
It for you? Yeah.
So Kieran, how do you spell the tardic therapy? So maybe you'd put that into the
TRT, just TRT.
TRT.
Yeah.
Okay. Christian, as opposed to Christina. Christian says, thank you. No problem, Christian. Amber says, would ginger powder help? Well,
Ginger is warming in general, for Vata, the spices, ginger, turmeric, the general things. Yeah, they are good to have anyway. Yeah, because ginger is a natural antioxidant, natural anti-inflammatory. So it's fine to have ginger because it improves the blood circulation. So by improving your blood circulation, it will help. Yeah.
Yeah, you can use it in your cooking. That's how I use ginger. I just get raw ginger from the supermarket and just use it in cooking all the time. Really, you know, it's very good for helping with your digestion as well. If you have weak digestion, which Vata people can have, or irregular digestion, it's very good for helping with that. Siobhan K.O. Myra says, really appreciate your 7-lesson course on Ayurveda. I'm going to show everybody where they can get that in a minute, just after losing my way there. Okay, back. Siobhan Casey says, many thanks, Rajvinder. Julia McGuire says, what is the web address? It's ayurveda.ie. I'll show you that in a minute. Recommendations on castor oil. We do use castor oil. I'm not sure particularly for tinnitus, Dr. Rajvinder.
Not internal, because it's a very thick oil, and that's why I'm not suggesting sesame oil either, because I think it might produce a bit more wax. So a more runny oil like olive oil in general, if you don't have bilge oil, is better.
Okay. And a similar question from Christian. He says, what about olive oil? Where his parents come from, olive oil is in high regard, and my doctor suggests putting a few drops in the ear at the time of irritation.
Absolutely. If you infuse a little garlic in it, that's even better.
Okay. Kathleen says, after listening to you, I think it's inflammation with me. So that would be a pitta side of it, Rajvinder, I take it.
Yeah, pitta side. Inflammation in general in your body is causing that in your ear. Yeah, so you need to resolve your inflammation. Food, maybe look into your inflammatory food if you're eating any of those.
Put some turmeric in the food.
Yeah, that's very simple thing, but you might do more than that.
Okay. Is chai helpful, from Deborah? It's nice in the morning time. It helps me. I don't have any ringing in my ears, but
I don't know, it helps with tinnitus though. Yeah.
well, it's very
less
nourishing,
caffeine.
chai. It's
If
very,
that's
very
what you
nourishing.
mean, if that's what you mean, it's less caffeine than coffee, or caffeine.
Yeah.
To reduce caffeine, chai is good.
I mean, it's got a different lot of herbs and spices. It depends on how you make it. One of my favorite things about going to India is getting up at about 5:30 or 6 o'clock in the morning, and no matter where you are in India, go out onto the streets and there'll be a chai wala, somebody making chai, generally with a fire going. And even if you're in the middle of Delhi, and they'll be making fresh chai, and they put it in a small little cup, and it's very sweet, and it's really, really beautiful. Really, really beautiful. Okay, so excuse my pronunciations here, okay, but Prabodh Mystery, I was prescribed
an antibiotic for fungal infection, and it is a recognized side effect that the hearing is affected, and sometimes it clears up after the drug is stopped, and sometimes it just doesn't. So it is a recognized finding with that antibiotic is the answer.
Okay, and is there
probably they still have fungal infection in their system, so I suggest looking into that a bit more deeply, that you need to clear that fungus candida from your system.
Okay. Amber says it's better when I sleep well. Okay, well, sleep is very, very much related to stress, and people not sleeping properly is a huge cause of. There's so many things go on when you sleep at nighttime. You think you're doing nothing, but your mind and your physiology is as busy at nighttime as it is during the day. It's just doing different things, and sleep is essential for getting rid of stress and anxiety and things like that, and not holding on to things. Actually getting a good night's sleep, you'll be able to forget arguments you had with people. You'll be able to let go of things. They won't grip you so deeply. But if you find that you're gripped by minor little things, you can't let them go, you're probably not sleeping well. There's so many positive things go on with a good night's sleep, so especially for Vata people, you know. Are you saying intermittent fasting could be a cause? I don't think we said that at any stage, but
if you're very much Vata and you don't eat for 18 hours or more than that, depends on what kind of intermittent fasting they're doing, and you're a very skinny person, then it lead to more lightness, more space in your body. And that can, as a temporary, then it will be a temporary thing. It shouldn't be a chronic thing then.
Okay, Kathleen says, I have it 6 months now and had a bad cold in December. Well, Kathleen, you have the advices there that you can begin to use. Can we have the chat from Roberta in Scotland? Hiya, Roberta. No 3 dots here to save it. I'll see what I can do about sending out the chat. There is a GDPR issue with sending out the chats because it's got everybody's name with it. So Yeah, this was asked before, so it might be a problem, you know. I don't think we'll be able to send out the chats. So Sonia says, so clear and to the point presentation. Dr. Don is here. Yeah, we have Don on. Sorry, I have to leave. Jimmy, thank you, Dr. Raj. Wonderful. What do you mean grounding? Grounding is kind of like if you've been watching a load of TV, or you've been hyper, or had an argument with somebody, or your nervous system is out of balance, or it's hyper, then you need to ground yourself. You need to bring yourself back down. And there are certain things that are great for grounding, like doing a set of yoga postures is very good for grounding. Going for a walk in nature is very good for grounding. Meditation would be good for grounding you, just bringing you back down from a hyper situation. And you may laugh at this or whatever, but walking in your bare feet on the beach or on the earth is also very good for grounding. Every plug in your house will have will be grounded. It'll be connected into the earth as well. So walking in your bare feet is a good thing for grounding. So thank you very much. Okay, what time are we now? Okay, we're getting very close to the end. Brahmi herb or oil from Julie McGuire.
Both could be beneficial, but for the pichu, it's oil.
Okay, so Stephanie says Dr. Brennan and Dr. Don is rather quiet, but I think that's because Dr. Rajvinder has done such a wonderful job that there isn't really too much he has to say, really, you know. I mean, you did cover everything in that, Rajvinder. It was really good, you know. So Roberta says, you're sending me difficult words, Roberta. Healy, can you pronounce that? Healy tourism oil behind the ear can help.
You just suggesting aroma oil, that you put that aroma oil behind your ear. That might help. Yeah. Aroma oil could be beneficial. Yeah.
Okay, and Diane says, very useful talk. My tinnitus has happened since perimenopause. Would I be able to access the webinar recording? Yes, of course you can. I'll show you where you can get that now, or you can drop me an email and I'll send it to you. Noel@ayurveda.ie. Can you use Brahmi oil as eardrops? I think we covered that. Mine developed while on HRT. Yeah, also being diagnosed with glaucoma around the same time. Okay, I'm just going to stop now. I'll just read this one here. My doctor told me to take a steroid spray nasal for 3 months before she can refer me to an ENT specialist to rule out any specific ear problem. I am very reluctant to do this. I am very Vata and I know this. So that's from Nav. Well, I don't think we're going to be contradicting whatever your doctor has told you to do, but you can add in all the things that have been suggested by Dr. Rajvinder there this evening.
Yeah, your doctor is trying to reduce the inflammation with the steroid and see if it clear itself. Then you don't need, they're not going to refer you. But if it's not clearing, then they want to rule out what's going on. So yeah, I don't know what to say on the steroid really. I can't say anything, but it seems like he or she is treating the inflammation.
Okay, we'll take one more question before I share my screen with you. It's from Eilish. She says, thanks for this information. I wonder about perforated eardrum, which doesn't heal. There's no tinnitus, but the ear is vulnerable to wind and water and crackles and pops sometimes. Is it possible to cure this? So all of the things that were suggested there, as in covering your ears during the winter time and protecting them, and maybe sea swimming is not going to be a great idea unless you put in earplugs. But anything specific, maybe we'll bring you in, Dr. Brennan, seeing as you're being so quiet, for Eilish, perforated eardrum.
Sometimes it's self-heal. Give it more time.
I think,
and then use the nasal drops.
Yeah, and I think the issues that we're discussing, the general health issues are always all relevant. I think using the nasal drops, having a good night's sleep, having relaxed, regular meals, plenty of rest, dealing with stress, because the body can't heal if there's energy gone everywhere else. Whereas I think if you can bring yourself to a better balance, and also don't believe that it's not going to heal, because it's like you're telling your body not to bother. No, you've got to intend that healing. You've got to take responsibility for your health and do everything for your health. And yes, use the simple nasal oil ongoing. And I think it's generally settled the Vata.
Okay. So listen, I want to share the screen. Someone just asked what the speaker's name was. So the speaker's name, the main speaker was Dr. Rajvinder Kaur. I'm going to share my screen here. And I'm going to go to our website, okay? So someone asked what the web address is. So there it is there, ayurveda.ie, ayurveda.ie, okay? And the first thing you see, because it's one of the things where I like to promote the most, is our free 7-lesson online course, okay? This we did at the beginning of lockdown in COVID. We were all locked in. We couldn't go very far from our homes. And I asked the doctors, would they be interested in putting together or doing a little course on Ayurveda? And we had an unbelievable response to it. We had well over 25,000 people register for this course. And we recorded the lessons, and I picked the best of them and I put them into this 7-lesson course. So you can click anywhere there for more details. So basically, you just have to put in your name, your first name, last name, and your email address and click register. And what happens is that you'll get 2 lessons every week for 3 weeks, and then a 7th lesson on the 4th week, okay? And these are the lessons: an introduction to Ayurveda, a lesson on Vata, a lesson on Pitta, a lesson on Kapha, rhythms of nature, digestion, and the 6 stages of disease. The one that's really important for tonight, well, they're all very important, but the one on Vata is very, very important for people that have tinnitus, how to balance your Vata. But actually, when you do that course, you'll have a very, very good idea what your main dosha is. We all have all 3 in us. We all have Vata, Pitta, and Kapha. It's just that 1 or 2 tend to be dominant, you know. And down the bottom there's some testimonials from people that did that course. The first one there is from John Duffy, who's a cardiologist that was working in Galway, you know. So it's a fantastic course. I recommend anybody that hasn't done it to register and do that course. And if you have done it, I recommend that you redo it, because there's just such valuable information in there. On our home screen, you can also get the contact details for all of our doctors. Dr. Brennan is the only Ayurvedic doctor. He's a medical doctor as well as an Ayurvedic doctor. He's the only one you can book online. You can see his diary and book him online, but he only sees people via Zoom. The other doctors, actually, Vijay Naheed is not in Cork anymore. She's in Dublin. I keep meaning to change that. And Dr. Rajvinder, who's the speaker here this evening, is in Lucan. And then we have another Dr. Chaitrali, and she's also in Dublin as well, in Carrick Mines, I think it is. So you have phone numbers and you have email addresses. I would advise to email them, because you mightn't get an answer if you ring them. So just email them if you're interested in setting up a consultation. The other thing I want to do is bring you to our YouTube channel. We have lots and lots of free content. Someone asked there about the, now, unfortunately, you probably won't get the same view as I do, because I own this, I have this YouTube channel, you know, but you can see there's the menopause Q&A there. You can see it on the screen. So you can just look at that. And there's Regina talking about the effects she had on arthritis and the menopause. And all of our old Q&As are there, and there's lots of different playlists. There's tons and tons of information on that YouTube site. So you can see the address for it there, but the easiest way to get to it is just from the website. Just go to the homepage of the website, and then just click on visit our YouTube channel. This is the homepage of the website, and just scroll down and just click on the YouTube channel. Now, for people in the UK, we have a website that's called ayurland.co.uk. I couldn't get ayurveda.co.uk. So it's exactly the same website. It's exactly the same website. The only thing is that the products, any products that are on it, are listed in sterling rather than euros. We have a lot of people in the UK that follow us and support us, and you know, so we set up a separate website for them, but it's essentially the same website. It's just that the pricing is done in sterling rather than in euros. And again, you can go down, and there's lots of different health notes about cholesterol, menopause, all different things, and then there's all that information on our YouTube channel as well. We also, for people who have a good understanding of Ayurveda, generally when you have an appointment with an Ayurvedic doctor, it's for an hour, because the doctor has to explain a lot of things about Vata, Pitta, Kapha, and lifestyle and all these things. But for people who have a good understanding of Ayurveda and only have one condition that they want to talk about, we also do an online 20-minute consultation. And you can see the web address for that there. I'll actually copy that and put it into the chat. So it's on Calendly. Some of you may be familiar with Calendly, you know. So it's a 20-minute Zoom consultation. I think we only have dates up until the end of June on that particular one, but it is strictly for 20 minutes. It costs €25. It's for people who have a good understanding of Ayurveda already, and they just want to talk about one issue where they want some advice from one of the Ayurvedic doctors. And it's just a matter of clicking on the time there, and you can see the different time slots that are available. But as I say, if you're new to Ayurveda, you're better off doing a 1-hour initial consultation if you want to go further with Ayurveda and some of the conditions. So I'll stop the share and I'll come back. So I think that's it. We've come to the end, really. I'm sorry if we didn't get to answer your question. Sometimes we don't get to answer all the questions, but I think if you go back through the video, there probably will be an answer to your question in there at one point or another. The other thing you can always do is just set up a personal appointment with an Ayurvedic doctor as well, you know. So I want to thank Dr. Rajvinder very much for putting that together. There was a lot of work involved in putting all those things together, and it was excellent. And someone says, can you send the link for the 6-week course, please? I've just shown that how you get that. Okay, so just go to the website and register for it there. And just if you missed it, if you went out of the room or something like that, then just go back over the video when I show it to you. But just go to ayurveda.ie and click on register for the 7-lesson course, you know. Okay, everybody, thanks. Rajvinder, if there's anything else you want to say?
They're asking, is it covered by insurance? Maybe you can talk about that.
Is Ayurveda covered by insurance?
Yeah.
Well, that'll depend on your insurance provider. You know, I would say generally not, no. But we don't get involved in that. We can give you a receipt. Ayurveda is not recognized by any health authorities in Ireland. I mean, Dr. Brennan is a medical doctor as well, even though he doesn't practice as a medical doctor, he practices as an Ayurvedic doctor. We can certainly give you a receipt, but other than that, you just have to. Some of the health insurance companies do pay for alternative treatment.
Alternative, yeah.
Some of them do, but we don't promise that, and we don't get involved. Other than giving you a receipt, we don't get involved in it in any way, shape, or form. We're not in the insurance business ourselves, you know. So check it out with your insurance provider. Do they do alternative treatments? They probably never heard of Ayurveda, unfortunately, even though maybe it's definitely becoming more and more popular. So check it out with them, but don't assume that it's automatically covered by your insurance, you know. So that's fantastic. So thanks very much for that, Raj. Dr. Brennan, thanks very much for coming on. And I think we'll be seeing you at the weekend anyway. And yeah, that's great. And just Tamara is a great supporter of Ayurveda. She's down there in Dingle, and she says, wonderful session as always. Brilliant presentation, Dr. Raj. Thank you so much. So we'll end with that. So thank you very much, Tamara. So thank you, everybody. Bye-bye, and look out for the recording of this video that I'll send out in the next few days.
Thank you.
Okay, and thanks very much for coming on. We hope you get something from it. We hope you get something useful from it. Thank you. Bye-bye.
Bye-bye.